Good day, everyone. I'm Dr. Baldonado from the Nuclear Medicine Department. I would like to say thank you for giving me this opportunity to discuss my case report entitled Extrapulmonary Tuberculosis Mimicking Malignancy on FDG PET-CT scan. Tuberculosis is a common disease in the Philippines, with an average incidence of 554 out of 100,000 Filipinos. It most commonly affects the lungs, but can also affect other parts of the body. Extrapulmonary tuberculosis represents 15% of all cases worldwide. Lymph node and musculoskeletal TB accounts to 30 and 10% of these cases. It has diverse manifestation, which can mimic other pathologies like malignancy, making it more diagnostically challenging and frequently associated with diagnostic delay compared with pulmonary tuberculosis. In here, I will be discussing a rare case of a 29-year-old Filipino male who complained of back pain radiating to the sternal region without any associated history of trauma, nor any signs and symptoms of chest pain, difficulty of breathing, cough, colds, or fever. A chest CT scan was done, which revealed lytic lesions with soft tissue components in the posterior aspect of the right 7th to 11th ribs, sternum, and the vertebral bodies, as well as a lobulated mass adjacent to the porta hepatis, intimately related to liver segment 3 and in the pancreatic neck. The characteristic of this lesion on chest CT scan appeared similar to a malignant process. Hence, the patient was referred to nuclear medicine for a whole body PET CT scan. The scan revealed FDG uptake on the lobulated mass, likely representing a conglomerate of enlarged lymph nodes. FDG uptake were also noted in the lytic lesions with soft tissue components seen on chest CT scan. These findings were suggestive of a malignant process. To make a definitive diagnosis, the patient underwent a CT-guided biopsy of the right 7th rib, with a final histopathologic report of crustacean granulomatous inflammation consistent with tuberculosis. The patient was then treated with anti-TB medications for 12 months. 2 months of the isoniazid, rifampicin, pyrazinamide, and ethambutol, and another 10 months of the isoniazid and rifampicin. A follow-up PET CT scan was done after therapy, which revealed cross and metabolic resolution of the large lymphadenopathies and metabolic resolution with sclerotic transformation of the multiple lytic lesions seen on the axial and appendicular skeleton, likely representing a favorable treatment response to the anti-TB drugs. FDG PET CT scan is a nuclear medicine modality that has been widely used for assessing malignancy. FDG uptake is reflective of the glycolytic activity of cells, which is increased in malignant tumors as well as in infection and inflammation. Latest evidence on the accumulation of FDG on tuberculosis has been studied. Upon infection with Mycobacterium tuberculosis, macrophages are polarized towards the M1 phase. The M1 polarization is synced with metabolic reprogramming of the macrophage, in which the glycolytic flux is increased. This state of early macrophage activation is necessary for the production of antimicrobial and pro-inflammatory molecules, which will attempt to clear the infection and promote granuloma formation in order to prevent dissemination of the mycobacterium. The components of the granuloma demonstrate some degree of FDG uptake. Hence, FDG PET CT scan is not a tumor-specific agent and may cause false positive results in cases of malignancy, most especially in patients with ongoing infection like tuberculosis. The diagnosis of extrapulmonary tuberculosis involves biopsy and pathological examination of the affected organ. Once diagnosed, anti-tuberculosis drugs may be given. For my conclusion, tuberculosis is one of the most common infectious processes that can affect different organs of the body. It usually presents with various signs and symptoms, typically simulating malignancy. Differentiating extrapulmonary tuberculosis from malignancy is difficult and makes the diagnosis challenging. It shows increased FDG uptake in PET CT scan, causing false positive results. This is to emphasize that when a patient presents with enlarged lymph nodes and osseous lesions, the increased FDG uptake on PET CT scan may not necessarily be an indication of a malignant process, and extrapulmonary tuberculosis should be considered, most especially in patients from endemic areas like the Philippines. Pathological examination still serves as a vital role in the diagnosis of extrapulmonary tuberculosis. That is all. Thank you for listening.